a form of complex PTSD and severe depression that causes suicidal ideation and self-harm. So how do you cope with this complex PTSD?
I have a mouthful of chocolate, so I can't remember that. So, you can ask me about that.
I guess I can address more of the emergency standpoint, because I obviously don't do the outpatient counseling or medication management or anything like that. But if it gets to the point where you feel like you're a threat to yourself, you can't function in your daily activities of life, then that's when an emergency department visit is warranted. And my job as an ER doctor for those who are having a mental health crisis is, first of all, make sure you're medically safe, make sure there's not a medical diagnoses that's complicating what's going on. So majority of patients who come from mental health crisis, you get screening labs, blood counts, electrolytes, kidney liver function, thyroid, and then you routinely do alcohol, urine drug screen, urinalysis, and then if you're of pregnancy bearing age, you get a pregnancy test. And then once those labs come back and we say, okay, medically there's nothing that needs to be treated on an emergent basis, then we determine how you are psychiatrically. How we do that is in conjunction in what I assess from you. My assessment is sometimes when I have the time, we're not that busy. I'll talk to it later about what's going on. Frequently it's the ER. Frequently I'm running my little tail off. And so I get kind of a bird eye view. And then we either rely on a telepsychiatrist evaluation or comprehensive mental health / pathways evaluation. Both of those are done telemedicine, so you talk to a real person on an iPad. How we make the division between the two is unfortunately based on insurance, and that's not us doing that. That's kind of how the funding is. So comprehensive mental health takes care of those already enrolled in the services, no insurance, or UPHP or Medicaid insurance. The after hours comprehensive mental health is Pathways, which is just a company that that services after hours. And then everyone else who has Medicare, private insurance, VA, they get a telepsychiatry consult. So it's a board certified psychiatrist that you talk to. Anytime you're in the ER for mental health, it does take a while. Like, you won't be in on an hour. It'll be several hours, sometimes longer. And basically our decision point is, are you safe to go home with, these are the resources you can use. Sometimes a psychiatrist will recommend medication adjustments for some people depending. And are you not an imminent threat to yourself or anyone else? Or are you a threat to someone else or yourself? If you're safe to go home, reliable, we can, give you counseling resources, things like that. We send you home with a safety plan. If we think you're high risk or high enough risk that you want to be hospitalized, then we pursue psychiatric hospitalization. That can happen on a voluntary basis or involuntary. Voluntary means that you accept the help, you want the help, and then we find a psychiatric hospital for you, and then you're responsible for your own transportation. So typically families or friends. We do now actually have a contract with a company called Delta Force for those people that want to be voluntarily hospitalized and you don't have your own transportation, we can consult them. They're out of Escanaba. And then if you're a serious threat to yourself, like if you leave here, you're going to hurt yourself or someone else, then we can do a 72-hour psychiatric hold. So it's a court document. It's a document. The initial form is a clinical certificate, which I fill out. It gets eventually signed by a judge. It's a 72-hour psychiatric hold. So in better terms that I can't think of right now is you can't leave the hospital for 72 hours. And then you also get a clinical petition that is filled out by anyone. It can be the officers commonly fill them out that someone's brought in by an officer, a family member, a friend. Last resort is one of the nurses, but we typically try to have one of the officers or a family member or friend fill it out. And it's just a secondary document that supports my document. And then in terms of kind of the last piece, psychiatric hospitals. Unfortunately, we're in a resource poor area for psychiatric help in terms of emergency stabilization.
somebody that you trust, that you feel comfortable with if you're dealing with this and it's not an emergency, you're not in the crisis point, but you're really dealing with complex PTSD. It's very complicated. I mean, and shop around. Don't feel like you have to take the first person that you see. If you don't feel comfortable, you need to find, because it really is teamwork. It is literally teamwork. You're going to be working with this person very closely. Yeah, and hang on to hope. Hang on to hope that you can heal, that it takes time, and don't expect it to happen. You know, complex PTSD is usually long-standing. It's been there for a while. It takes a while to undo some of those coping skills, which may be harming yourself, and to create some new neural pathways in your brain for peace and healing. So shop around, find a good therapist, and create your own your tribe and your clan of people who are going to support you. You know, be picky, be choosy, but by all means do that.
Right, this question is specifically for the Copper Shores and law enforcement. The question is, what is the easiest way to reach out about sexual abuse or assault if you're a victim of that?
Yeah, so realistically, there's no right way. It's whatever you find. So whether it's through law enforcement, you contact your local law enforcement agency, they contact us directly, or it's just through all the doctor's office, usually have our on-call schedule, as well as you can just call our 24-hour hotline, or call our office, reach out on social media, or reach out through our website, through our emails that are provided on there. No matter how you reach out, we will have an advocate that is there for you and that is available. We have advocates that are called 24/7, so if it's after hours, reaching out to law enforcement or reaching out to your medical service provider may be the best option just because they do have our after hours phone numbers. But no matter where you're looking, if you do need help, we are here to help, and we will have a SANE exam ready for you if that's what you choose. At Meriden, we'll have an advocate that's here to walk you through the process and the difficulties that lie after that.
Brady, this is a follow-up question. If you feel a child is a victim of sexual abuse, what's the first step of advocating for them?
So ultimately, if you feel that a child is a victim, first you want to make sure that that child's safe. First and foremost, that's the most important thing. So if you do feel that there's a child that is being victimized in some sort of way, get them to a safe place, get them to a place that's non-judgmental and a place that they can feel secure. And contact either your local law enforcement or CPS. They have all of our contact information, and if a follow-up with our Houghton Child Advocacy Center is needed, we are always there to provide support, whether that's through an interview directly with the child, or whether that's just through family support and supportive services that we can offer. But first and foremost, child safety is paramount in what we do. So if you ever do feel there's a victimization of a child, if they're within your care, get them somewhere safe. If they're not, report it. There's no harm in making a CPS report and having a professional follow-up. It may seem like there is, especially if you've dealt with CPS in the past and have had negative experiences, but just because CPS is called doesn't mean that there's a problem. That just means that they need to follow up on something and that they're doing their job. So contact CPS. They are a resource and an ally, not an enemy.
Thank you. Absolutely.
What do you do if CPS isn't listening to the child at all?
And that's an absolutely fantastic question. And children can oftentimes be misconstrued. And if you feel that CPS isn't listening to the child, then you're more than welcome to contact us directly here at Copper Shores and at the Houghton Q1L CAC. We are here to help provide support. We work very, very closely with our CPS partners as well as our law enforcement partners. So we have a very strong connection with them. And we pride ourselves in having a strong connection with our families and our victims and making sure we do what is paramount important for safety and for the child's safety, for the family's safety. So if you feel that CPS maybe isn't taking a step that you think is necessary, contact us and we'll be sure to follow up. And maybe whether it's going through CPS or looking at another agent to review CPS, we can absolutely follow up and ask the question.
And for victims of sexual assault, maybe you're not ready to move forward with it, you can always still get a hold of law enforcement, we'll still take a report, doesn't mean we have to move forward with it right away. Sometimes it's better to get it out and have a report in case you wanna fall back on it. Cause just because you're sexually assaulted, not every victim can go past that part, but at least it's documented and for later, later times if need be. It is, but I'm gonna, no means no, no matter what the situation is. Again, you can always bring it to law enforcement, have it documented. I'm a believer in document, and you can always move forward later on. But as Braden said, you gotta be safe, and we want people safe. That's our number one priority, is safe. And going back to CPS too, if you're not comfortable with something that's going on, call your local law enforcement, and they'll take a look at it also.
Thank you for clarifying that. Go ahead.
I'm just going to quickly add with the marital abuses is a very serious problem and a very prevalent problem, not only within our community, but everywhere we look. So, and it's hard. I mean, on average, it takes 7 times to leave a domestically violent relationship before you're actually able to depart and separate your life. So it's not something that's easy, and it's not something that's expected to be solved overnight. But whether that's involving law enforcement or whether that's just reaching out to an advocate or someone that you feel is an advocate for you, there's always options. So it takes strength and it takes time to take that first step, but letting someone know what you're going through, letting someone know your trauma and your history and what has been happening is one of the hardest steps, but it is one of the most important, because it not only allows you to accept it as an abusee, but it puts blame on the abuser, allows for that process to begin.
This one's for Sarah and Sonia. Says, so it's talking about caring for family and friends who are, so like not the actual patient, but the family and friends of the patient. So how do you handle and feel about caring for family and friends, whether you have somebody in your life going through surgery or somebody going through the end of their life scenario? How do you deal with the family and friend aspect of it?
I've met a lot of different families with a lot of crazy, family dynamics. I've seen a lot of different, but I think something that would be helpful for any of them would just be your support. Because like I said, with the end of life caregiving, it's like a 24-hour job. And they can't go shopping, they can't, take care of their basic needs. So like even if you just sit with the patient so they can get out of the house and provide them with like that little bit of respite relief so they can kind of have their own time. That's really important, that they are still caring for themselves too, as they're trying to support their loved one. So that's what I would say.
All right, this one has a few sub-questions to it. So the first question says, is it too late to tell someone if you were raped in the past? And then what can I do if I have a doctor who refuses to help with my pain? Maybe I'll just start with those and then I'll go to the last part.
As for if you've been a victim of a rape, no, it's never too late to come and report that.
Just to add on to that, I mean, your pain and your victimization, it does follow you through your entire life, but it is your story to tell, and there's no time limit on that story. If you feel comfortable enough, if you have the strength to come forward right when victimization happens, fantastic. If not, there's nothing wrong with that. It is your story, you tell it when you feel comfortable, and so we are always here to provide support, whether it's yesterday, whether it's a week ago, whether it's 5 years ago. And we have victims that come in and admit to their abuse that happened 30 plus years ago, and it still affects them. And we help them just like they were any other victim that we see.
I just want to address that really quickly. If your doctor doesn't listen to your pain, switch doctors, because literally you have a right to be heard and seen. And if somebody is not, and when you're this vulnerable and sharing that kind of pain, I don't care if you're sharing pain, you know, in your big toe, or you're sharing the trauma of something that happened to you, and somebody's not listening, that's not a good healthcare provider for you. That's not a good therapeutic relationship.
And kind of depending on what kind of pain you're having, if they're not listening to you and